Welcome back to this Wednesday 1:30 edition of Chamber Chat. My name is Brad Kloffenstein. I'm president of the Greater Lawrence Chamber of Commerce. This is our ongoing series where we try to have community leaders come in and talk to us about what's going on in and around Lawrence and hopefully give us some pearls of wisdom, and otherwise it's an opportunity for us to get to know them better. This week, our honored guest also happens to be a Greater Lawrence Chamber ambassador, so he's known to several people. Kimble Richardson, he's the manager of business development for Community Health Network Behavioral Health. He was appointed by the governor to the Behavioral Health and Human Services Licensure Board, where he serves as board chair. So without further ado, I'd like to introduce our TV star as seen today on Channel 13, Kimble Richardson.
Thank you, Brad. Wow, that was super. I'm going to have to hire you and just have you do my introduction all the time. That was awesome. Well, hi, everybody. Thanks for joining, and I appreciate you guys having me on. I'd like to tell you a couple different things about what's happening specifically with behavioral health care in around our area and the greater Indianapolis area, and frankly, a few things that are going on statewide. Just a couple of extra bits of background. I'm a licensed mental health counselor. It's my 33rd year in healthcare. Very proud to be representing and working at Community Health Network, which is a big supporter and cheerleader for the Greater Lawrence Chamber. So thank you, Brad. I'm happy to share a few things, and then if people have questions, happy to do it that way. Brad, I don't know how you'd like for me to take it from here.
Just go ahead and tell us a little bit about what you've been working on and healthcare as you see it, and then I'll ask some questions. We'll take some questions from those who are in attendance.
Okay. We well, guess what happened 7 weeks ago? Our lives changed forever, and so did mine. Ironically, I feel like I'm a guy who likes to be busy. I don't shy away from work and putting in many hours and being active, but I literally became busier than I ever have in my entire career, and probably putting in 14, 18-hour days for days and days at a time. And so what was happening was I was working on two very big projects. One is leading a group that supports our Community Health Network employees. It's a peer support group that provides emotional support to the people that we have working in the community. And we already had that program stood up and operational for several years prior to the pandemic hitting. But of course, once that hit, as you can imagine, we had lots of requests from our team. And our team is about 80 members. That's not just behavioral health. It's from anybody who works in the hospital. You have to have special training and other things to be on the team. But essentially, we, prior to about a couple of months ago, prior to the second week of March, everything we did was in person. If somebody had a request for individual support or group support, we would provide that in person. But we were told you can't do anything, and you can't even come into the hospital right now, anywhere in the network. You have to do everything virtually. So we started doing debriefings, one-on-one meetings, all kind of interventions virtually. And we've been somewhat resistant to that in the past, but we've frankly had to get over it and right quick in a minute. And we stood up lots and lots of meetings. As you could imagine, guys, it's been pretty intense. We have lots of stories that are difficult to hear, but that if people don't get them out and tell somebody else, that can cause some long-term mental health and physical problems. So we feel very honored to support our other frontline heroes that are tending to patients who need the care. So that's a big project. That's ongoing. We have lots of things happening that are where we get requested for a one-time event, and some things that we've stood up to be recurring. So, for example, we're supporting our intensive care unit staff, and we have meetings going on recurring for those folks. That's Community Health Network. Outside of Community Health Network, I'm the coordinator of the District 5, which is Marion County and the surrounding counties, so there's 8 counties total. The District 5 Resilience and Emotional Support Team. The state of Indiana, for those of you who are a little bit familiar with emergency management, we are under the Indiana Department of Homeland Security. We are divided into 10 districts in the state. Each district has somebody that's in charge of emergency planning and management, and each district has a mental health team assigned to it as well. Some are a little more active than others. As you can imagine, the team that's in District 5 has been fairly active. On March 13th, we were activated. And what that means is the Division of Mental Health and Addiction said, okay, you guys get ready to go. We were told we had about 24 hours notice. And we said we were given a mission. And the initial mission was to support the staff. When I say support, I mean emotional support, to support the staff of the Indiana State Department of Health. They were standing up their call center for folks from around the state calling in regarding questions about COVID-19 or the coronavirus. And they were getting, rightly so, overwhelmed with the amount of calls and trying to handle people's emotional crisis, which that wasn't necessarily their job. So we got a group of, very, very quickly, within 24 hours, we're probably up to 25 agencies now that are helping to support these missions, hundreds of volunteers. And in that time, we've added 3 other missions to our goals, if you will. So not only are we supporting Indiana State Department of Health staff, but also the Indiana 211 call center staff. They are currently a nonprofit agency that has less than 40 employees who normally, this is a referral and resource line. So if you need some information, you call 211. They normally were taking, somewhere between 1,000 and 2,000 calls a day. When the pandemic hit and people were saying call 211 if you need information, at one point they were up to 25,000 calls in a day. So yeah, I can see right? That's amazing. And their staff were pretty stretched, if you can believe it. They had, some staff that had been there for a while, but really about 34 of the 39 FTEs, those people had been on the job 5 months or less. So they frankly were fearful of losing their workers to that stress and pressure. So we quickly shifted gears and said we need to support their staff as well. And that became a very interesting and intricate model that we got set up. Now, everything that we're doing, of course, has been based on science and crisis intervention principles that we already know. But some of it, frankly, we made up and we put together. And it was at the last minute. And actually, it's been working out really, really well. In fact, that mission is almost done. We are done with 4 weeks of that. We've got 2 more to go. And the people who work there are telling us, please don't stand this down. It's been so helpful and so supportive. And we really appreciate it. So that's very satisfying as a crisis intervention worker to know that you can put something together and see that it's helpful too. In addition to that, so we also are supporting the Indiana Department of Workforce Development. They have a call center staff of about 175 state employees, but they became so busy with trying to take calls about unemployment, about the stimulus checks and things like that, that they added an additional 100 people to their call center that are contracted, but they need support too for their staff. So that's one of our missions. And then finally, some of us have specialized training in working with first responders. When we say traditional first responders, police, fire, EMS, and the 911 dispatchers. So our thought was, let's put something together for them. So we did, and then our original minds told us, well, let's keep this to District 5. We've got dispatchers and police, fire, EMS, a lot of folks here in the District 5 area. And then we said, well, look, why don't we just offer it to anybody in the state of Indiana? Some of them are virtual. We're virtual. Let's go for it. Let's do it. And we've had such a tremendous can-do attitude. It's been a pleasure to lead this group and to coordinate all these things. I mean, it's not been without I call it, I got crusty a couple times. I mean, it was, not getting a lot of sleep and putting in a lot of effort. I got stretched a little bit, but everybody's been super cooperative, professional. It's been great. And what we're doing is we're helping our Hoosier sisters and brothers, and that gives us a lot of pride. So there's a lot going on. There's a lot, of course, we need to do still, and that could be done. But that's just a little snippet of what my life's been like for the last 2 months here.
Interesting. All right. So, Kimble, let me ask you, what have been the biggest challenges you're hearing from A, both the healthcare workers, but B, just the public at large who've been basically shut in at home for the last 6 weeks or so?
Right. Well, some of the biggest challenges that we hear from healthcare workers are, number one, I'm afraid. I'm afraid for my own safety. I'm afraid I don't want to get sick and die. I see people dying. I'm trying to hold people's hands when they're dying and they can't have family available, or at least that's how it was in the first several weeks. I'm trying to be in all kinds of gear and equipment, and yet I'm trying to be compassionate and be there for people. That's been very, very challenging. And as you can imagine, it takes a certain personality, a style, if you will, to be a frontline worker. These are can-do people. They get the job done. They run toward danger and don't run away from it. But sometimes when it also involves something that you don't understand, you can't see, it's unknown in some aspects, right at the very beginning at least, that's scary. And frontline people don't like to feel afraid. So that's been challenging, but it's been nice to see. And this is one of the ways that this works, is that not only, you don't always have to be a mental health professional. Peers like to be supported by peers. So if you have an intensive care unit worker that's being challenged and distraught, we get another intensive care unit worker who's gone through our support training and try to match them up together. So that's very, very effective.
So as far as patients, what feedback do they give you? What is it that they need? Because as you say, my impression is their families can't be there with them.
Boy, we've tried to do everything that we normally do. I mean, I think, it's a gut-wrenching time for us in healthcare. We're trying to attend to patients in the way we normally have, but we couldn't. We literally almost overnight had to switch our whole way of doing healthcare in a lot of ways. And the virtual business, albeit, I'm an in-person guy. You probably are not going to get me away from some kind of an event or meeting or something where I can be around people. But even I'll have to say, doing some things virtually, it's been all right. And we've been able to extend ourselves and meet with people just like what we're doing right now. And it's still okay. It's maybe not the best, but it's better than the alternative, which is no support.
So one other question I did have for you, what recommendations can you make to people right now who are staying at home? How do they keep their sanity?
Well, I'm in that same boat, Brad. So literally, guys, I'm trying to take my own advice, and it's not my advice per se, but the advice of all the mental health experts is it's really important that you keep a routine. And why is that? Routines help us to feel comfortable. They keep us on track. They help us to understand the boundaries between when I'm at work and when I'm at home. And just like, see what I'm wearing, I'm kind of dressed up. I'm kind of a dressy up kind of a guy anyway, but I've been dressing up every single day, and I'm sitting right here. I'm looking out my dining room window, and I'm trying to keep a sense of sameness and saneness, if you will, to my routine so that I know when I'm at work and when I'm not at work. In addition, everybody needs their own space, and sometimes we live in close quarters. Just before I started, I had to go down to tell my son, hey, I'm going to be giving a presentation, so you got to chill out for an hour, you know what I mean? So we have to do what we need to do. Tried to tell the dog and the cats to be quiet too. We'll see how that works.
Nice. All right, we'll go ahead and open it up. Questions from our assembled guests here. Anybody have a question for Kimble?
Kimble, this is Tom Crouch.
Hi, Tom.
It seems to me I've heard of as many suicides as corona deaths. How are you dealing? People are cooped up and relationships get frayed. Hopelessness can enter everybody's mind, either about disease or jobs or the future.
Well, I know I've been a little jokey, guys, but this is no joke. Tom, you're 100% right. Suicides are increasing. They two things are happening. One is there are increases issues of domestic violence. One of our hotlines here that we have in the city about a week ago gave a report and told us that there have been a 400% increase in calls to their hotline that had something to do with domestic violence issues. They've had 100%, it was like 128 to be exact, percent increase on the number of calls regarding people who have had thoughts of suicide. So I know that it's serious and it's an issue. And one of the things is that sometimes when disaster strikes, we have acute behavioral health reactions that we are trained to know how to deal with. In this case, not only did we have that, but we're going to have another surge. This is my prediction. I think many behavioral health people would agree with me. Once the survival mode, like I got to just survive in the next few weeks. Once that part calms down a little bit, we'll see a little bit more behavioral health needs. Folks that are dealing with depression, thoughts of suicide, and things like that. So, and we're already starting to see it.
Other questions for Kimble while we have him? All right,
well, as you're thinking, I don't want to leave you with that. That's kind of like a bummer ender, right? You know what I mean?
Well,
so,
Kimble, this is Tom. I was going to say,
Tom.
this is Tom again. I was at Eastern Star today and had my corona test.
Yep.
And they were very professional, and it was a good experience. If having a Schwab up your nose is a good experience. But so I'm anxious to see if how healthy I am.
Well, here's one of the cool things that you just told about that story is that is sponsored by the Marion County Public Health Department. And they have a staff, a social work staff of people who are helping to man that, if you will, a person that. And the Marion County Public Health Department is one of the organizations that's part of District 5 and part of the way that we're helping to deliver service to folks. So it's been a great opportunity. And Tom, I will say prayers for you, sir, and hopefully that you'll be safe. You're as inquisitive as you always have ever been. So that part hasn't changed.
Now, Kimble, I see that we have a question from Nicole. She asks, are we going to have more testing stations in Lawrence?
Yeah, that's actually a good question, an excellent question. I don't know how to answer that. Yeah, I'm sorry. I don't know. I don't think, Community Health Network as a network is not offering testing, but that would be a good question for either calling directly to Marion County Public Health Department, because they partnered with Eastern Star to do that setup, and maybe they would be willing to partner with another organization.
So now that kind of dovetails into a question I had as far as capacity. We hear every day the numbers that we're using 25 to 30% of ICU beds, as well as a similar number of ventilators. How does that compare to the capacity we had in January? Do you happen to know how much capacity we added, and would we have been in trouble had we not added that capacity?
Yeah. Well, a little known fact, perhaps to your audience, is my own wife is an intensive care unit nurse at Community North. So I have the information for you. And thank goodness we've had that capacity at Community. And we also, of course, have an incident command system that communicates with the other Marion County and surrounding county hospitals. The capacity for ventilators and the daily bed count is known, and that's been thankfully not overextended. We've been able to handle that capacity so far.
Okay. How much did it go up? Do you know, from January to now? What's that increase been?
That's a good question. I don't have it for you. I can try to find out and get back to you.
Okay, yeah, we can.
With that, but that's an interesting question. I know that stat is kept, obviously, because not only do we coordinate with the surrounding counties, but also with the state for those kind of issues.
Okay. Questions from the audience?
Hey, Kimble, I'll ask one. Appreciate and applaud your efforts that you've done. Have you done this with your existing team and resources, or have you had to augment that?
Well, I'll tell you, here's the cool thing about being a Hoosier. We rise to the challenge, man. And we just put out, so the answer is yes and yes. Yes, we've done this before, but also, yes, we needed extra help. And when we put a few feelers out there, it was like, wow, it was amazing. People said, yes, I want to help. What can I do? And then it became trying to manage your volunteers, which was also a interesting challenge, right? Because not everybody who wants to volunteer is appropriate for certain missions. So we had to vet people's backgrounds, and not necessarily their legal backgrounds, you guys know what I mean, but their training and their expertise. But it's been doable. I'm sitting here to tell you that you can be proud of what has been stood up here in our own community to help our own people. Of course, it's never enough, but what we have done, I think it's been pretty cool. So, Cassandra, you had a question I thought I saw.
Yeah, Kimble. Most employees have access to an employee assistance program to help them, with these kinds of needs. But if someone doesn't have access to that and they're in Lawrence, are there, or some of the surrounding counties, are there resources available to them?
Yes. And there are some that are the Community Mental Health Center. Now that's a big C and a small c. So the community of Lawrence is situated geographically within Community Health Network's Community Mental Health Center, that currently it's called Gallahue Mental Health Center. And that's based on people's income and needs. That's our duty, to take care of people who have mental health needs and may not have another resource. So that's available. I also can tell you, in case there's anybody out there who's had a loss or a death, a friend or family, et cetera, that has been related to the COVID-19 pandemic, we are offering a free virtual support group for that. And I can tell you already, even though we're offering it at Community Health Network, people from around the country are calling and joining in. So this is, and I can give you, Brad, that link for people to connect to that. So
yeah, both those resources, we could put them on our website.
Thank you. Really, okay, I'm sorry, Sheila.
I'm sorry to interrupt.
Okay.
I talk to over 100 sixth graders every week, multiple times a week. And as we know, if you have children or grandchildren, or you've ever met a child, that they can hide their feelings like the best of us. And with a small hour, or I see them 2 hours a week via Zoom and virtually. Do you have any resources targeted for children, for our grandchildren, our own children, or my students, where it's targeted for kids?
Yeah. I'm just going to make a strange assumption that you have a school system in the Lawrence area. Is that correct?
I'm actually in Franklin Township, but it is
Okay.
in Marion County.
Why don't you connect with me one-off, Sheila? It's not that I don't want other people to hear the information, but I may have to ask you just a couple extra questions.
Awesome.
And then I can target a response to you. And guys, I've had the same cell phone number since the invention of cell phones. I don't mind giving it out. I've given it out to, over 25 years, and I really haven't had any problem with it so far. So here it is. It's 317-418-0988. 317-418-0988. And here's my email address. K Richardson at ecommunity.com. K Richardson at ecommunity.com. Of course, that's Community Health Network address.
Awesome.
But
I appreciate
I'd be happy
that.
to help you out. Yep.
Thank you.
Thank you, Kimble. One last question before we let you go. Are we ready for murder hornets?
Well, if there's not a question, I do want to say thank you to the Lawrence Chamber, to Brad and Erica. It's frankly, guys, when I started out in my career, I got a lot of crickets whenever I offered to do a presentation about behavioral health. And ironically, there's a lot of calls for behavioral health presentations at the moment. And I'm thankful that you've thought of that this was important to share. So appreciate you guys.
Well, Kimble, thank you very
Thank
much
you,
for
Kimble.
joining us this week. You've been fantastic. Thank you to everybody
guys.
who tuned in. As soon as we're done here, I'm going to edit this and I will post it to our YouTube channel for the Greater Lawrence Chamber and also on our Facebook page. Keep in mind, tomorrow night at 5 p.m., we'll be doing our Zoom happy hour. Everyone's free to join us. Bring whatever beverage you like. We'll have
Another coping skill.
Last week we went about an hour and a half. Next Wednesday, I've got several feelers out for guests for our chamber chat. Hopefully I'll be able to announce something this afternoon or tomorrow. And then next Wednesday night is our first cruise-in car show at Lawton Loop. So thank you again for everybody who joined us. Have a great week. Kimble Richardson, thank you again. And
Thanks, guys.
see you all soon.
Thank you.
Bye-bye.
Thank you.
Bye, guys.